plan that would sort of cover basically all drugs across Canada consistently. That never got off the ground. And we tried a national home care plan that would try to cover home care consistently across the country. That never got off the ground. Okay? So we still now are, depending on which province we're in terms of what the coverage is for anything other than hospitals or medical. Okay. Yep. Well,
Just curious, which province seems to be moving towards, because really with the shift to primary health care, is there certain provinces that are providing more of those extramural services?
I can't answer that question. I can't answer it. I don't follow that close enough. Does anyone have any thoughts on that?
New Brunswick has a pretty good extramural.
Sorry?
I said New Brunswick has a really formal extramural hospital program for home support.
Mm-hmm.
You actually formally get it, it's a hospital system that you get admitted to outside of a hospital.
It has lab services, pharmacy.
Right, see patients, it's like a hospital.
I thought,
Yeah. What about Quebec? Don't they have a broader plan, I think? I'm not positive. It's not something I monitor closely
Is
enough.
this the only problem that people have to pay their
Premiums? No. Premiums are still in Alberta, I think. Oh, no, they just wiped out premiums in Alberta, didn't they? Well,
At least since it started, since
That's what I'm sure.
yeah, fairly recently, Alberta wiped out the premiums. So I think that that's like BC is the only.
I'm sure usually there's 2 weeks of services, but if you have,
Ontario doesn't have premiums, does it?
See?
Ontario doesn't have
Yeah.
premiums.
no. Yeah.
Ontario still serving premiums?
So income tax,
Sorry?
so income tax, that's the.
Yeah, okay. There's not very many provinces left where there's also a premium, okay? In a lot of provinces, it's just to generally take it out of the general tax revenue and grab the healthcare portion of the general revenue fund. Okay, so universality means across Canada, portability, universality means everybody, portability across Canada, accessibility, which is very contentious because in the sense of that's there, but there's no doubt that some citizens have a lot more accessibility to health care than others can. And you just have to discuss or look at the difference between urban Canada and rural Canada and see what happens to people who live in rural Canada and what their accessibility is compared to those who live in major metropolitan areas. But nonetheless, and then public administration means that it's run by the government. Another change occurred, this is around 1996, and it basically, they combined not only health and education, they also threw in social assistance. So the federal government now, in effect, started making one payment to the provinces on this tax point per capita formula, and it was for one amount for health, education, and social assistance. And the provinces were in effect free to decide how to then use that one pot and how to distribute it within their own provinces. And that particular one was also at the time the federal government was trying to bring down the national deficit. So there was a huge drop in healthcare dollars at that point from the federal government. So in BC lost $800 million from 1995 to 1996 for healthcare, and this new plan came into play. The most recent accord, the 2000 accord, which went into effect 2004, which again restructured the formula again. At this time went back to isolating separate transfers for health and separate transfers for other programs, including education and social service. So what it is, it made the health dollar more prominent as to what exactly was the health amount that the federal government was contributing to the provinces. Okay? Because the federal government for years, decades, has always argued that they're being mistreated, so to speak, because the Canadians don't recognize the contribution they are making, they, the federal government. And some provinces will argue, such as Alberta, argue the federal government, as far as they're concerned, could go away and disappear. But others, such as in the Maritimes, the federal government's contribution is significant, because the provinces don't have the resource base, so it varies. So it's, I think the last number I saw was that as far as Alberta was arguing, the federal government was only contributing 11% of the healthcare dollar. The province is contributing 89%. But in other provinces, in the Maritimes, the federal contribution is closer to 40 or 50% because of the revenue base. Robin?
Can we just go back to 1996,
1996,
last?
back in time. Yep.
What happened then, again? Why was there
Federal
an
government-
$800 million decrease in receipts?
Because the federal government was trying to, well, they did, brought the national deficit under control. So they basically just didn't give the federal, they didn't give the provinces as much money.
Do you know how they reacted to that?
Well, violently. Well, violent's too strong a word. It wasn't popular.
But what, because it's,
It wasn't
I've
popular.
been working since about 1992,
Yeah,
and that is about the distinct time when I think there became, like, back in 1995, it was the doctors that were running hospitals. Like, the doctors were actually doing, they had power. We had power to purchase equipment, we had power to do
Right.
things.
right.
In about 1996, that's when our jobs started to become more miserable. There were all of a sudden, all these admin people telling us what to do, and we could not do anything without the people from above telling us how we were gonna do our
Yeah, well,
business.
it's probably,
And does that,
probably related, probably, the amount of money the provinces had for healthcare dropped significantly. The amount of money that the provinces received from the federal government for healthcare dropped significantly. Okay, I can't remember what the percentage was, in terms of the 800 million in 1996, what percentage drop that was, but it was a significant drop. So then all of a sudden, the provinces had to either start making cuts themselves, or find some new money.
but it seems to me the healthcare system is spending a lot more money on admin now than they used to.
Be careful on that one. I don't think that holds up.
No?
No, I don't think the evidence, the last time I looked, which was quite a while ago, the evidence was that our admin costs were well below American and even below OECD standards, OECD norms. So I don't think that's, it may seem like that, but it's not really. I mean, regionalization had one of those effects. Regionalization significantly reduced administration costs. Yeah, Bobby.
Kind of what Dr. Paul was saying that,
Sorry, remember,
the province just mandated a 10% reduction in public health costs, which were supposed to be the core services that worked for IH. And when that happened, everything switched over. We had MHOs running public health, actual doctors, and now it's for corporate. Because we have to
so this is where?
in Interior Health.
Interior
We're
Health.
completely restructuring because of the announcement that we made.
Now, this is the very recent announcement?
Oh, yes.
Yeah, like very, very recent.
Yeah, very
Yeah, it's very recent. Yeah, we're headed into another stretch. I mean, and the full impact, I'm not an economist, but my sense is that we still have not felt the full impact of the latest recession. And that we're still going to feel it. BC didn't significantly touch health and education last year, but this coming year is not nearly as, and you're telling us there's going to be a significant cut coming. I mean, I've heard someone say in Alberta that Alberta might do again what they did in, when was that? When did Alberta make their 5% cut across the board? About 10 or 12, 15 years ago. At one point, they, what? Sorry, someone know the date? They cut 5%, all public salaries of any kind, 5% across the board. Shame. And I heard from an Alberta colleague that they're thinking that they might do that again.
We work with a shared services model, don't they, compared to the BC, or we have our regional authorities, they're just one out.
At the moment.
Yeah.
Yeah. But that's a decision though that's beyond the health authority. That's a provincial decision. Because it cut across the entire public sector. including teachers, I think, everything. That's about, it was the 80s or something. It was drastic. But, and apparently that's being resurfaced, so I'm told. Okay, Robin, I can't answer whether or not you're right, but maybe you're right. Could be. Do you want to do a project on Robin? Okay. So the latest, what we're working under is the 2004 Accord, which is bringing new money. It's bringing new money into the healthcare. The 2000 Accord basically committed the federal government to reinserting money back into healthcare, back to higher levels than what they had done following the 1997 cuts. And these are the kind of numbers that we're working with. Okay. So, our healthcare system. The latest forecast came out just about, it's about 3 or 4 months ago. That when 2009 numbers come in, I don't think they're in yet, but when they all come in, we will have spent $183 billion in healthcare in Canada. And the number is not significant. What's significant is the 11.9. 11.9% of our gross domestic product in 2009 was on healthcare. Okay? I suspect that, again, I'm not an economist, but I suspect that when the 2010 numbers come out, we will be well over 12%.
I believe the US is 16%.
US is 16 right now, let alone what they're going to be next year. Yeah. Or they're 16% as of 2007, which is the latest OECD data we have. Why is it going to go well over 12%? Do you think?
Aging population.
Tracy?
The gross national product go down?
Right. We're not going to produce as much. Okay, so that's a number based on how much we spend in healthcare divided by what we generate as a country in terms of our economy. And although I think Canada is generally considered to be one of the better off countries in the current global recession, we're still going to be hit hard, I suspect. We'll see that go up because so far there has been no major cuts to healthcare. Richard, did you want to say something?
I was just curious whether or not the aging population would also have an impact.
Could have an impact. There's mixed stories on that. Mixed stories. There's no doubt that the aging population is a factor, but there's mixed accounts. Some economists are arguing that the aging factor is not that big a factor. Even though 70% of our healthcare expenditures are on chronic disease, and it's primarily our elderly who have chronic disease, not only, but primarily. But there's also some arguments coming out that our aging population, as they get age, are healthier. Not quite.
Yeah, from working on the front line, I would say definitely it's the aging population. There are shifts that I do in the emergency where I would see 30, 40 patients, not one of them is under the age of 75. So we see it like on the front line. I don't know if the numbers add up, but definitely they're the sickest and they take the most resources.
Another facet of our healthcare system, of course, is that we spend a significant amount of money in the last 6 months of life. We spend a large amount of money on people in the last 6 months of their life.
So what data are these economists looking at that are saying?
This is economists out of Stats Canada, and they're looking at the broader picture. And I can remember reading one paper now, I can't remember how long ago it was. I don't read in that area as much as I used to. But they were showing, they were arguing with their numbers that the aging factor perhaps wasn't as big a factor as the lifestyle. The lifestyle factor, I think, is their main argument, is what's causing the problems. Yeah.
There's this new study saying that we are living longer. So therefore, on average, the age of